Hello, everyone, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria STONE-OZBEK, and tonight we have a very special guest. Our guest tonight is Miss LaToya Rivers-Azanga, and she is a program manager of quality process improvement. And tonight she is going to be talking to us about how healthcare data analytics is used in the medical setting. So without further ado, please join me in welcoming Miss LaToya. Hello.
Hi. Good evening, everyone.
Well, thank you so much for coming on the show.
Yeah.
I want to say first, just start off by telling us a little bit about who you are and what you do.
Aha. Well, who I am is a long story, but how it involves with what I do. I was one of your general pre-med students, thinking I was just going to go to school and become a physician. And then I realized that there's so much more to healthcare than just the provider providing, treatment to patients. And I think it was the beauty in having a curious mind of wanting to know about different specialties of healthcare. So I went down a path of looking into ancillary services, physical therapy, speech therapy, and got my start off as a technician in therapy services, helping patients who maybe have had knee surgery, hip surgery. I was doing that to work my way into physical therapy school, and then I fell in love with operations. Just like, hey, I like to get things done and get patients through. I was one of those people that was like, who can go. And get their work done the fastest. And it's not always about being fast, but it's about being efficient. And so I think just those ways in which I think really drew me to healthcare administration. So healthcare administration in itself is a really big um, pocket of healthcare. It's not just registering patients. It's not just making sure they collect money. There's so many things that are tied to it. In a patient stay in the hospital, a patient comes across on average 50 people. That's who's registering you, who's pushing you to your room, who's helping you with your insurance information. God bless those social workers through any kind of needs that you got going on outside of just, taking care of your immediate needs, connecting with family. And your pharmacist. And so you really think about all the specialists and all the really the army of people behind the delivery of care. Um, sent me down a path of becoming, I would say, well-rounded, but basically a Jane of many trades. And so I've went and worked in a lot of different areas of healthcare, and how that landed me to where I am now is finding out about Lean and Six Sigma. So ultimately, um, how you optimize your processes. Toyota is very famous for it. Is very famous in other industries about, like even Ford, the competitor of Toyota, right, had his own quote with like, coming together is the beginning, keeping together is progress, and working together is success. So it's like, how do you optimize what you're doing? But we're dealing with people, not making shoes or cars.
Yeah.
And so that's the thing, is that it's become this new subspecialty in quality in healthcare over the last 20 years, and picked up really over the last 10 years of organizations hiring people who are trained to use certain tools to help them dig into the processes and be consistent about it. And that's the thing about healthcare, is that it's an art, right? So including all that science that goes in there, you don't treat every patient the same, even though you should try to be similar in your protocols and types of care that you provide. And so what Six Sigma does is decreases variability. It says if for a patient with A, B, and C going on, this is what you should do. And you should do that pretty consistently every time. But again, there's variability. Somebody may have, you know, um, two conditions, let's say congestive heart failure and, just had a knee replacement, versus someone that does not have that same condition, but they're dealing with just the knee issue. Should they have the same protocols, or should their medications be a little bit different? So looking at all those different ways in which we treat patients, and using statistical analysis to combine with that. So research background and interest in statistics got me in the door of understanding healthcare data. I became a certified health data analyst through AHIMA. The American Health Information Management Association is a great organization if you're someone that knows that you want to be involved in healthcare, but you're not heart set on just clinical work. It really helps with medical terminology. A lot of clinicians are going through and using their skill set to pair with other things like compliance, coding, all the different pieces of how do we identify each patient. And so through initially just population health, percentages of change, patients who are coming through the hospital with certain diseases, providing dashboards with just that basic information has kind of skyrocketed, I guess, my career because I've been able to combine that with process engineering. And so you have industrial engineers um, that are more commonplace in other industries, but now more so in healthcare. They're really looking into how to um, manufacture healthcare, if that is the way to put it. Make something that is a little bit, is different. Healthcare is different than other industries, and so I think it was a good way to take tools as a non-clinician, but be able to help support the cause because providers are, they're in the trenches. The nurses and physicians and the diagnostic teams are sitting there trying to find out information quickly, see what's going on with everyone's health. But then how do you make those decisions without having that information too? And so being able to get surgeons and hospitalists and different types of providers information about, hey, generally with this type of patient, you guys, they are seeing this type of response, whether it be they come back in 30 to 60 days, or they have decreased surgical site infection. So all the different outcomes and results that you want for a patient. And
Mhm.
generally the result is to go home, go home and be healthy. But, people, once you, particularly geriatric population and pediatrics, they're in and out because, you're growing up and being exposed to different things. And so um, business intelligence, I guess, is ultimately what I've been able to create and make a living off of. So glad to
Yeah,
be here.
absolutely. So if
Yeah.
you had to put
Yeah.
it in layman's terms
Okay.
so everyone could understand, define what an analyst in healthcare does.
Yes, yes. Um, mm, I could put it in layman's terms in regards to just gathering information.
Okay.
But how it's unique in healthcare is because there's so many different angles to it. There can be analysts for the financial side, so they can understand, what's going on, like how busy a clinic is, how busy a hospital is, and provide those kind of metrics and where the average amount of patients per day and how does it help with staffing and are they meeting their goal. And then there are analysts that are help with population health. So they pull all the patients who see a certain type of doctor or who have a certain diagnosis. And then they have analysts that are helping with systematic aspects, research, and also helping identify where patients are falling through the cracks. So I've supported research previously at academic medical center, and there you could get asked very interesting things like, how do we tackle this type of disease profile? And you're really looking into general trends and all of that. But yeah, if you're a curious person who actually found statistics interesting, it is really a growing industry and you need more people that understand computer programming. I think it's a great opportunity for people to know that there's more to do in healthcare besides just, directly treat the patients. I mean, there's a lot of need for it because of all of what you guys do on the patient care side, all that's getting put in databases. They have health information exchange that they've been trying to get the United States on for several years, and only certain states have got on board with it. But they're really needing to collect more information, and they'll be able to help, in that hive mind mindset. Like a lot of people have shared their COVID data, that's been required because of that, and because of avenues like that and interest on certain population like congestive heart failure, as I mentioned several times before. That's a big challenge for our nation. But now COVID has kind of changed our perspective on it. But collecting all that information um, and giving that back to the providers is really insightful to let them know maybe they could tweak their treatment plans, that maybe the certain combination of medications plus exercise or whatever, as they come up with these treatment plans for the patient, having that data back is really important. So that's what analysts do.
Yeah.
Um,
So what specific, I guess you would say, area is your main focus?
So it has changed through different jobs that I've had, but most recently is helping with throughput, getting patients through the emergency department,
Mm-hmm.
and also helping with patient satisfaction. And so I get to spend a lot of time really identifying yes, how we get patients in. We want them there. It's, it is a business, and also we want to help with overall wellness, but how to do that most efficiently. So their CMS, the Department of Health and Human Services, really are looking at organizations to be efficient with their care. For an example, um, somebody can go to the emergency room, get a test result, not like it, not accept it, and then be like, okay, well, I'm gonna get a second opinion and go to a different provider, you get the same test again. And so that's, their, way of auditing and getting checks and balances and making sure that something's real. But think that's only one person. Imagine the millions of people who get second opinions or just go between one organization, one doctor to the next. And that makes the healthcare costs really more than what it should be. We're one of the worst in the world in regards to cost-effective care, and so definitely helping providers understand and the organization understand that their supply chain cost. Supply chain is
Mm-hmm.
something that's very dear and important, but been a hot topic lately, especially when hospitals ran out of gloves and masks when COVID first hit. Yes, everybody's like, hold on, y'all ain't got gloves.
Yeah.
And yeah, and I think that is something that highlight how important that is. I've worked on actually supply chain projects, making sure that there is enough on hand, but that supplies are not expiring. Sometimes you can get a little excited and be like, "Oh yeah, let's get plenty. We'll just backstock it," but it expires after so much time.
Mm-hmm.
And so being efficient with what's stocked and what can be stored, that there's a lot of math that goes to that, a lot of information that needs to be shared and decisions that have to be made to ensure that you're stocked with what you need to make things go well. You communicate to the patient so they understand what to expect. You go to the hospital, you get a survey, and they want to know how they did, and it's a pretty stiff competition. All the hospitals are working on it. They want you to come to their hospital instead of the guy down the street.
Right.
Some people are not so lucky if you're in like rural healthcare. It's the only hospital in town. But when you live, in the urban areas, you have a lot more options. Making sure that people know that they can go to urgent cares instead of the emergency department for some things, and that's actually better for the health system. It's
Mm-hmm.
cheaper to take care of you at an urgent care. So if you have a headache or stitches needed, that an urgent care is the most cost-effective place for you to go. But a lot of people just only know the emergency department if they're in pain, and sometimes they just go there. And you do what you have to do. But educating the public on how to use the healthcare system is something that's indirectly tied to the work that we're doing to make sure that we can effectively and efficiently take care of patients.
Absolutely. I think I have about a $3,000 emergency room bill right now for a headache.
Yes, yes, yes. Those MRIs, CAT scans. Mm-hmm.
Yeah, I was like, what?
Mhm. Yes, and that's another thing too, radiology. Didn't realize, I mean, if I could redo life, I was like, "Radiologist, they make what?"
Yeah, they do
They have a good
pretty
living.
well. We have
And
some chiropractic radiologists that
mhm.
do pretty well. Yeah.
Mhm, and it's like, "Oh, I didn't know that," 'cause, you're like, "Yeah, throw the kitchen sink, do all the tests," and you didn't realize how much each of those tests cost. It's, using those expensive machines are, again, life-saving, but they do cost a bit, and so,
Yeah,
yeah.
they even charge you separately for the technician who actually,
Mhm.
conducted
Yes,
the
yes. Mhm.
films or
Yeah.
MRIs. So it's
Mhm.
it's crazy.
So, yeah, and that's another thing too, in another life, I also sold insurance. So, when I say I have a pretty interesting background, I've tried almost every, position, non-clinical position, and probably a lot of what I do now, clinicians are doing as well, and so more physicians are getting into Lean Six Sigma and nurses because they're realizing that, your clinical programs, med school teaches you how to treat the patient, but how to
Mhm,
operate, the system of taking care of a
mhm.
patient is very different. They learn that on the job, and so taking in principles from industrial engineering is really been insightful. So I think there is more to ensuring that multiple disciplines step into improving healthcare overall. It's a team sport,
Yeah.
healthcare. Mhm.
So, what are some common misconceptions you think people have about healthcare data analysts?
Well, I guess a lot of people particularly think that being an analyst is just you're tied to a desk type of job.
Hmm.
And I think that's why I don't have the title of analyst anymore, is because in some roles it can be. You just sit there and you run reports all day. But I'm a people's person. And so, but having the analytics background was really important. So the same reason I didn't get into research, which is, what I did all my underground work in, is because I'm like, well, I'm a people person. How do I take that I like to know things, but share it with people and make it something that's satisfying for the type of work that I have to do. Is that it's really broad. So I started out, I guess, in my hospital life over the last 9 years as a data warehouse administrator. So there. Um, you think warehouse, you think that most people think of like Amazon and pieces of data um, that way. And so really data is the same way, and not just dealing with physical products, is that information has to be stored in a certain way. So if you're an organized, very type A person, it's a
Mhm.
job for you. um, but so is everything everybody has their place is what I'm trying to get to. And so I started as a data warehouse administrator, and I liked being able to look at the information and see what was all there. And I think a lot of people think that their jobs are going to be like that, but there are so many jobs behind analysis. You have
Yeah.
people who need to be very techy in that whole cyberspace and making sure that there's actually information sorted and organized in a certain way. And then you have people who pull out that information and they organize it for what's going on in that organization. Then you have people who interpret it. Then you have people who implement with whatever the data is saying. So you have to get from typing in some information about a patient to actually having an executive report to the CEO and the chief medical officer. It could be 8 different people. So there's a lot of specialties within analytics. And so some are people facing, to where you'll be reporting to executives, letting them know what's going on with their business, or you could be in the back end and writing SQL code and computer languages, and they're changing every day. I'm even behind on in analytics because now you need to know Python and all these different newer languages. And before, when I first got out of school, learning knowing Excel and C++ was enough. But now
Enough.
you're needing to know different languages and updates to that. And a little bit of SQL was able to help get my foot in the door. And now you're needing to know multiple languages, just like in the real world. It's becoming more diverse, so is data languages. And so there's a lot of options in analytics, and it's not just for the introverts.
So, in an effort to improve various processes, do you all
Mhm.
get a lot of kickback from like the physicians who kind of think they know everything, or?
Oh yeah. That's another thing, and I think that's the people-facing part as well. Besides just the people who build data platforms in the background, you have to have the people who take that information and got to go in front of the providers and be like, "So, see, what had happened was um, you have a few patients die, and that doesn't look good," or you have to tell them about, "Oh, hey, you're using certain supplies that are very expensive. Like, yes, we know you like this particular stent or this type of equipment, but it costs twice as much as the other doctors." And so there's all kinds of information, and they won't believe you. So definitely, data is king,
Mhm.
and making sure your information is valid and you can back it up is very important. And so I've been in meetings where we've talked about readmission rates, where patients get out of the hospital and have to go back because they're still not feeling well, whether they didn't get to their uh, clinic doctor fast enough, or they just couldn't manage well on their own and have to go back to the hospital. They look at those rates. And so I've presented some, and yes, and had a lot of pushback in regards to, well, data can't tell us everything. This is how I feel. And when you look at the data, it's there, and it's starking because you have to know how to filter it right, and that can be um, the difference in night and day in regards to compliance, whether people agree and are going to make a change because of the information they've been presented, or they're just kind of dismiss it. And I think that's a very important and improvement work, is for that everyone to agree on the data. And so that takes a little research and educating, honestly. So I get a chance to educate a lot of providers about that transfer of information from the electronic medical record, where they're entering information in and through this machine of the data warehouse, and then spitting it out to these reports. And sometimes you have to kind of walk through um, each element of information to make sure it makes sense, because, and again, there's a lot of variability in healthcare, and they want to make the right choices. And misinformation, or typing things in wrong, and all of that is a part of it too. So it's not an exact science, but you're right. It does require a lot of engagement, and it's a salsa to the back and forth on making sure that the reports are right, so that y'all can move forward and take care of patients in a most effective way.
Yeah, and I know one of the challenges with patient retention is a lot of times when they do leave the hospital,
Mhm,
I'm not going to say that the doctor is not clear
mhm,
on their instructions of what they want the patient to do, but
mhm,
oftentimes the patient don't know the procedure that was done to them, and they'll get like a handout or something that'll give them talk to them about self-care, but they don't really explain like why they're doing what they're doing or why they
mhm,
want this recommendation to them. And so
mhm.
they get home and then they're like, "Oh, okay, he just said put some ice on it," or whatever the case may be.
Yeah, no, and I've worked on projects in regards to that as well. It seems kind of silly, but when you get into more acute diseases and conditions, it can be really complicated. Health literacy is something that I'm really passionate about, and I've done projects where we really look at the literacy for health terms for the patient. I mean, there can be someone who's, professional, Ivy League educated. You can go through all these things about what the ideal patient would be and what their socioeconomic background would be, but that's not real life. And even if someone is educated, they may be too distraught to understand what's going on. You could tell them in simple terms. Someone's college educated about taking care of a port, or a new device that they need, and medications that they need to be on. But it is possible that they may know stocks well, but they don't understand medical terms well. So just because someone may seem like they're with it doesn't mean that they have a good understanding of medical terms. And so they really have been working to put things in layman's terms for patients, because it depends on your background and how you approach things. Like a good one example that I actually heard about at a conference once, right? In English, ONCE is once, 11 in Spanish. And a lady died because she thought they wanted her to take 11 pills a day rather than once. Because Spanglish, yes, they could understand enough English to
Oh,
get they thought, to get the instructions in English, but there was a misunderstanding on the medication. And so, yeah, so things like that, just those similar words between languages and people being distressed, that is really important. That you make sure that there's comprehension. So they've really spending a lot of time in healthcare organizations over the last 20 years. There was a book that came out, To Err is Human, that really talked about, that we have all these different goals to make healthcare more safe in the United States, and we've only gotten a little bit better. There's still people who are harmed in the healthcare system on accident. People are trying to do the best thing, but going between one doctor and one nurse and another, somebody going on and off shift, there could be miscommunications about what's going on with the patient, and they may have not gotten treatment in enough time, or other things like that.
wow, I'm speechless.
Yeah, it's a lot.
Goodness. Oh, that's so important. I know for many of us, we had our patient forms in English, and then we would also have a second set of patient forms in Spanish
Mhm,
to make sure that they understand. But oftentimes, they would have someone with them that speaks English,
mhm, mhm,
and I only know a little bit of Spanish, but I would try, and
mm,
they would like that,
mhm.
my patients. So,
Yeah,
no,
getting the Spanglish. But yes, yeah, and that's another thing too, is making sure that instructions are available in multiple languages. I think it's common for things to come in Spanish, but I've been in the Houston area where it needs to also be in Mandarin, and so you really need to know your population, and each hospital needs to understand their their community. I had the privilege of working at a hospital in Dallas, and they had a department, so a language specialist, and so they kind of managed a software where they could go in and get an interpreter for whatever language they needed it translated to. And again, there's many, many languages in this world, and so they had to like study what their population was, and they're like, okay, about 10% may speak this language, 20% speak this other language, and so they needed to really keep tabs on the fluency of their community, and they had about 20 different languages that they had to make sure that they had 24-hour availability for someone to talk to them and explain their care to them.
Yeah, absolutely. So, and it's so vital to have professionals on staff who are like trained properly
Mm-hmm.
to just kind of, collect, to store, to retrieve all of the information that they need, so that way you guys can do a better job at, putting the data all together and presenting results or presenting ways that you can improve the processes. So
Yep.
it's pretty awesome.
Oh man, thanks for having me here. It's really
Mhm.
interesting that you're, highlighting different specialties in the community to support healthcare. So I
Well, you
love
know
it.
what? It wasn't until I started this show, when I started interviewing different people, that I was like, oh my God, it's so many, amazing women in the background
Hmm.
that, play such major roles in healthcare that we often don't even think about, because, most people, if it's not a nurse, if it's not a MD or a PT or something like that, most
Hmm.
people don't even know
Yeah.
about the roles that they play in the community. So I wanted to just kind of highlight all of those roles. So, and that's how I came up with the name Random Healthish, because I'm like,
I
it's
love
just
it.
random topics of all types of things. So, but
Yeah.
just, I'm, I love it. I think it's pretty awesome. And I think that all practices kind of use healthcare analytics in their own way,
Hmm.
uh, because we have little systems in place for patient retention, or when was the last time this patient was in for a checkup. Like
Hmm.
in the beginning, a lot of patients fall through the cracks because you don't have systems in place to just kind of bring them back on. You know what I mean?
Hmm.
Miss,
Yeah.
yeah. Do you have any closing remarks that you want to leave with the general public tonight?
Oh, sure. Um, I think just knowing that information drives everything that we do um, is something to keep in your back burner as you move forward in your journey, whether it be in analytics and in healthcare and in take care of your own health. Now, we got telemedicine, that's the new frontier of healthcare, and it's not new, but it is the frontier, and now it's more in demand. And keeping up with the evolving healthcare that's becoming more technical, artificial intelligence is knocking at the door, and more of how we do healthcare is being put in an electronic format. And so I think that has shaken healthcare, because before, you just go in with your tablet and,
Mhm.
write down what's going on. But, things have changed from the old progress notes to now a bunch of boxes, and it's more like a standardized test, it feels like. But that's changed how we deliver care. And so I think evolving with that and keeping your ear to the ground is really important. Also want you to go to a website, dataheroawards.com.
Okay.
Data, yep, Data Hero Awards. There's a position in there doing some slash vote um, that is really doing some great work in regards to data analytics with COVID. And so, because of research and information collected there, I think she's trying to get recognized, and I think we should do her that solid if you have a few minutes.
Absolutely. I'm gonna put that on the Facebook page as well, so that people can find the information.
Excellent. Well, thank you. I'm glad to be here, and reach out to
Thank
me if you'd like to talk
you.
about data in any other way.
Well, thank you so much for coming on the show and just blessing us with your knowledge.
Oh,
Um,
thank you.
I think that, well, I don't know about anybody else, but I got a lot out of our conversation tonight. So I'm very
Okay,
excited about that.
appreciate
If you guys would please like, share, and subscribe to our channel so that more people can get the message. And also make sure to tune in every Monday night at 7 p.m. Central Standard Time. So we will see you guys next week. All right. Have a blessed evening. Good
Thank you.
night.
Appreciate you.